to the recording. This informational recording will be posted to the PHE Helper website. So please feel free to also submit any questions you may have in the chat throughout the training, and DHS will provide a Q&A follow-up after the presentation. All right. The Pennsylvania Department of Human Services Office of Income Maintenance welcomes you to our webinar, Medical Assistance Renewal Process, an overview for PHE helpers. To kick things off, I'll first introduce myself. I'm Alexis Dysenroth, Executive Assistant for the Office of Income Maintenance. And my partner today is Kathleen Gaszewski, Human Services Analyst Supervisor with the Office of Income Maintenance Bureau of Policy. So I'd like to take a moment to thank you all for joining PADHS in our effort to keep Pennsylvanians covered after the expiration of the continuous coverage requirement for Medicaid at the end of the COVID-19 federal public health emergency, also referred to as the PHE. As many of you already know, last week the PHE was extended through mid-January of 2023. The Biden administration has committed to giving states a 60-day notice prior to the official expiration of the PHE. So from now and through the unwinding, DHS will continue to send valuable information regarding the status of the PHE and how PHE helpers like you can assist. We hope today's webinar will do just that. So without further ado, I'm going to turn this over to Kathleen to give an overview of what the nuts and bolts of the medical assistance renewal process looks like for recipients and those that are there to help them navigate through it. Kathleen?
Hi, everyone. Good afternoon. Oh, hello. Can everyone hear me?
Yes.
Yes, we
I
can
can hear you now.
Yes, we can hear you.
Oh, geez, I'm sorry. I don't know what happened there. But I'm not sure how much you heard, but I was just saying that the purpose of this presentation is to give a general overview of our medical assistance, or MA as we call it, renewal process. This presentation is going to walk through a timeline of what our renewal process looks like in Pennsylvania. We're going to talk about some of the forms that are associated with that process, what's needed to complete that process, as well as what happens once a renewal is submitted for medical assistance. Okay, and before we talk about renewals, I'm only going to go over this fairly quick.
I think I got it.
Oh, someone have a question or an issue? Okay, I don't think so. So here I'm just going to talk briefly about some background about Medicaid or medical assistance in general. And the reason that I'm just going to touch base on these real quick is because the methodologies for MA sort of determine the renewal process for those individuals. So the two main groups of MA are either based on what we call MAGI methodology, which is modified adjusted gross income methodology, and that encompasses groups including pregnant women, children, parents, and what they call the adult population, or the Medicaid expansion group. And the groups that are not based on MAGI, which are sort of lumped into what they call a non-MAGI groups, those would be what they call age blind or disabled. Age would be age 65 and over. And this encompasses groups such as long-term care, home and community-based services, and folks with disabilities. The renewal timeframes for MA are dictated by our federal regulation. So that's what Pennsylvania has to adhere to. And I have the citations here for those regulations. But basically is that renewals have to be done every 12 months for MA recipients. And again, another reason why to talk about the different methodologies are that there are some different rules for how we treat income and resources for either a MAGI or non-MAGI group, and that sort of plays into the renewal process. But we'll get to that a little bit later here. Also wanted to give some background about the COVID-19 public health emergency declaration, and sort of give some information about why renewals are going to be important and why we're talking about them now. So just very quickly, in January of 2020, the US Department of Health and Human Services declared a public health emergency due to COVID-19. Since then, that declaration has been renewed in 90-day increments, and there was a recent extension, very recent, last week, which is extending the PHE now through January of 2023. And sort of hand in hand with the PHE declaration, there was a law signed in March of 2020 called the Families First Coronavirus Response Act. And within that act, there was a section that addressed Medicaid or medical assistance specifically, and it allowed for states to receive an increase in what they call federal medical assistance percentage, or FMAP, which is basically the percentage that the federal government reimburses states for Medicaid recipients, that there would be an increase in that FMAP figure if states would maintain eligibility for individuals who enrolled in MA as of the date that the FFCRA was signed into law. So PA has been following that provision and has been maintaining eligibility in MA for individuals since March of 2020. And these are folks who may normally not be eligible for Medicaid, either because they no longer meet the income or resource guidelines, or because they didn't follow through with the renewal process. But as I said, for the past, going on 3 years now, we have been maintaining eligibility without closing out eligibility for individuals. And then as we look forward to sort of like what is the Medicaid world going to look like post PHE, we have received some guidance from Centers for Medicare and Medicaid Services about what to do once the PHE for COVID-19 expires, and there have been some recommendations made from them about how to handle individuals who would not necessarily be eligible for Medicaid after the PHE has ended. And one of the things that they have stated is that those folks all need to complete a renewal before any sort of action to close their Medicaid or medical assistance can be taken. So that's why renewals have sort of come to the forefront, and why we're talking about them, and why that process is going to be very important going forward. So to start talking about our process in Pennsylvania, our process starts, it's approximately 90 days before the renewal date that is stored in our eligibility system. The renewal date in our system is always set to the last day of the month in which the eligibility would be set to expire. So for example, if someone was opened in October, their renewal date would then be set for the end of October the following year. So this process kicks off 90 days before that renewal date, when what we call a change reporting flyer is sent to our MA households. This flyer, it's a general flyer that sort of reminds households of changes that they need to report that could impact their MA eligibility. Um, we're asking them, sort of prompting them to make sure that they have the most up-to-date information available to us so that we can complete the renewal process successfully. And we recently updated the form. It was previously it had just been a one-page form. Now on the back of that form, we have some additional information about Compass and some other ways, the Compass mobile app, and how to sign up for text messaging, so that we're really providing recipients with all of the ways that they can receive communications from us. And as I said, it's important that we have information that is up to date so that we can ensure that the renewal process is successful. The actual systematic renewal process begins approximately 60 days before that renewal date that is set in the eligibility system. And there's an example there that if the renewal date is set for the end of December, the processes that are talked about here will begin at the beginning of November. And all MA renewals will take one of three paths, and they're outlined here. The first path is what we would call automated renewal. It's sometimes referred to as an ex parte renewal. And for these cases, what happens is they are funneled systematically through a process that uses data available from electronic services that we use to see if there's enough information available to renew MA eligibility without having to reach out to the MA household. So if somebody's able to go through this process, the system renews eligibility, sets out another 12-month period for the individual, mails a notice, and they never actually have to complete a renewal packet. It's all taken care of systematically. If that is not able to be done through the automated renewal process, it goes to something we call automated scheduling. And in this process, the system is generating a renewal packet to the recipient household, and it is pre-populating it with case information for the household to review or correct during the renewal process. And then the third path of what we call manual scheduling is if the individual or recipient has other benefits, example, SNAP or TANF, then the county assistance office worker will schedule a packet that will be sent out to the household. This packet will also be pre-populated with case information for the household to review or correct. And it is information that most recent information that we have on file is presented to them. And just to reiterate that whether the packet is coming through automated scheduling or manual scheduling, it's the same packet that would be generated. There's no difference in them. It's just how the packet is generated. But the actual packet that is generated, like I said, both will be pre-populated. There would be no difference in those. Next, as far as mailings go, the first mailing is the change reporting flyer, which I talked about. And then the next mailing that the MA household would receive is something new that we're introducing with the PHE after the expiration of the PHE, which is a letter that is going to be going out to the household that will again sort of reiterate that the renewal process is coming, that they should be expecting a renewal packet within a certain amount of time. It will give the information about how to complete the process. And it also is going to give them the information that they would need to complete the renewal via Compass, which is our online application, when they get this letter. And this letter is also going to be including an FAQ document that has some PHE specific information for the recipients in case they have any questions about how the PHE unwinding or how it's going to affect their MA or their renewal process. So we've gathered some of those questions and provided answers to them. Oh, I just saw, okay. So I'm just moving closer to the microphone to make sure everybody can hear me. Um, But yes, as I've said, this letter is going, it's coming out before the renewal packet, letting them know that it's coming, giving them some information about how to complete the process, as well as giving them some PHE specific information, things that they might be curious about, or if they hear things in the news, and they might want to know how this process is going to affect them. And we're hoping that this FAQ will help answer some of those questions for them. Okay, and now to the sort of main event, the main mailing that we send out, what we would call a renewal packet, um, gets mailed out to the household. Like I said, if it goes through automated scheduling or manual scheduling, the packet is generated. Um, it's I'm going to go over a sort of general information about the packets. I will say that there are several types of renewal packets that we maintain, and these are what packet is generated is dictated by um, what MA category is being received. But I'm going to talk about the most common packets that we send out. So that sort of encompasses the most MA recipients. But within the packets, even though there are differentiations in them, all packets will include the items listed here. The first is what we call an instruction sheet. That will be the first page that is viewable when you open the envelope. There is what we call renewal information letter, which provides the instructions on how to complete the renewal and information that needs to be submitted with the renewal. There's an actual renewal or application form that's included. And then every packet also includes voter registration information and an application for voter registration. Some packets will contain additional documents based on, again, what benefits are being received, whether it's just MA or if they're receiving another benefit type. There could be additional documents in there that they'll need to complete for those benefits. And an example is many SNAP recipients will receive a form that asks them to verify their shelter costs. And that is specific to the SNAP program, so we're not going to talk about that here, but I just wanted to make it clear that while we're going to be talking about forms within the MA renewal packet, there are forms that we may not discuss here that may be included in those packets. And I will say that the instruction sheet and the renewal information letter are going to be the best resources for the recipient to guide them through completing the renewal process. And we're going to be talking about those a little bit more in depth as we go on here. Okay, so like I said, the first page that they'll get when they get a renewal packet and open it up is what we call an instruction sheet. It's a very basic form and provides some really high level overview of what they need to do to complete the renewal process. It's just basically asking them to review, complete, sign, and make sure they're including all of the information necessary to complete um, the renewal form. So this is just like a very short, basic reminder about how to complete the process. The more detailed information is going to be found on the next form, which we would call the renewal information letter. Everyone will receive one of these with their packet at the very top of the form, and I sort of have it circled in red there. Um, it will provide the due date for the packet. It'll list a specific date there for the packet to be returned by. And there are two versions of this form, and it sort of ties back to what I talked to about the methodologies in Magi versus non-Magi. We have a form, a renewal information letter that is specific to Magi recipients and one that's specific to non-Magi recipients. And the reason that we have that differentiation is that Magi determinations do not consider resources. So the renewal information letter for that would go with Magi packets will not have any renewal or resource information on it, whereas the non-Magi renewal information letter will reference resources on it. This form at the bottom here provides all of the modalities that the renewal form can be submitted. It gives the instructions for mailing back, completing it online via Compass, or by phone through our Consumer Service Center, which is a number that recipients can call to have someone help them complete their renewal. Someone will walk them through that process to complete and submit their renewal. And then on the back of that form, the renewal information letter, and I'll show examples of what that looks like in a second here, but it will also have the current case information that we have pre-populated on it, and it would pre-populate both income and resource information for the non-Magi folks on the back of that form. It's just another way to provide them with information that we have on file for them to review and correct if necessary.
Hey, Kathleen, it's
Yeah,
Laura Humphrey from the DHS press office. I apologize for interrupting you.
no, that's okay.
I just wanted to let folks know here on the admin end, I am getting a notice that the meeting is supposed to end in 5 minutes, and I am troubleshooting that. I'm not sure why that's happening. But if folks could please just, if you lose connection to the meeting, we will try and fix that as quickly as possible, and just go ahead and sign back in. If we need to, we will send you an update email with the new information. And I apologize for this, just trying to figure out what's going on.
Thank you. So all we can, if we can, I'll just, this quickly here is what I'm showing here. This are examples of the back of the renewal information letter. And you can see that the one on the left, which is issued to our non-Magi folks, includes both income and resource data that we have on file, while the one on the right, which would be for our Magi folks, just includes income information. But on the back of these, they both reiterate the due date as well for the renewal packets there. Okay. Next in the packet, every packet will come with an application or renewal form. I phrased it as application renewal form because some of the forms you'll see that they're either titled application or some of them are actually entitled renewal form. So it'll depend on what form is being included. But even if it says application form, it is what is necessary to complete the renewal. And what form is included with the packet is going to depend on the benefits being received by the household. Um, for MA, the two most common forms that we send out are just the regular benefits review, also called a PA 600R, and that is sent out for folks who are in our non-Magi groups. And it is also sent out to any household that receives multiple types of benefits. So if somebody's receiving both MA and SNAP, they will get the PA 600R form. The other most common form that we send out is for the one that we use for our Magi population, which is our PA 600 HCR is what we call it. And the main difference between those forms is that the PA 600R will collect resource information, whereas the 600 HCR for Magi will not have that information on it. There are other forms that you may potentially see within packets. We do have a form that is specific to our buy-in program. So if somebody is only receiving buy-in of their Medicare Part B premium, they would see the form that is specific to that program. We have a form that's specific to our MAUD program. So if the recipient's only receiving MAUD, they would see our MAUD form. Okay, I think we got it back up here. So before the little break there, I was just trying to explain that we're going to talk here today about the PA 600R and PA 600 HCR in more detail, but I just wanted everyone to be aware that if you are assisting recipients in completing renewals, that you might see other forms based on what they're receiving. But like I said, the 600R, the 600 HCR are our most common. So those are the ones that we're going to touch on today. So just to get a visual, these are the front pages of both of those forms. The one on the left is what the front of the PA 600R looks like, also known as the benefits review. And on the right is the PA 600 HCR, also known as the application for healthcare coverage. Again, non-Magi households and mixed benefit households will receive the form on the left. Magi households would receive the form on the right. And no matter what form they receive, they would all be pre-populated with case data. Some of the information that is pre-populated is the name, address, phone number, some general demographic information, such as relationships, school status, and then also income and resource information is pre-populated on the forms. The recipients have instructions within the forms that they're to review the information that is pre-populated and to correct that or update that if necessary. The last bullet here, and something that we will talk about here, is probably one of the most important things, is that in order for a renewal packet to be considered complete when it is returned, it must be signed. So even if the household returns the packet, everything completed, all verification required, if it's not signed, it's not considered complete. So we want to talk a little bit about the signature and where they should sign. Okay. So for the signature, Again, like I said, it has to be signed in order to be considered complete. That is dictated to us in the federal regulation at the citation provided here. And for MA, the signature must be on the rights and responsibility page that is included at the end of all of our application renewal forms. There's a note here on the benefits review or the PA 600R. There is a field at the beginning of that form that asks for a signature. That is not for a medical assistance. It would not be considered complete if the form was only signed in that place. For MA, the form has to be signed on the rights and responsibilities page at the end of the application or renewal form. And here we just tried to pull out examples from the PA 600R and PA 600 HCR of what those rights and responsibilities forms look like and where those signature fields are. Because like I said, these are at the back of the forms. So if somebody's going through, maybe they might miss it back there, but it is back there and it does need to be signed in order for the renewal to be considered complete and to be processed. Another part of the renewal process is verifications. If a household receives their packet and they have information that is new or needs to be updated, they need to provide verification of anything that has changed since their last application or renewal. So for example, if they just started new employment, that would need to be provided with the renewal packet. And they would update that on their form and include any verifications that are necessary. And examples for income verification, I mean, it can vary, but obviously the most common would be copies of pay stubs, award letters if they receive anything like a pension or anything like that. Or if they're self-employed, the most common verification would be like a Schedule C from their federal tax form. For resources, if they are a household where resources are considered, they would need to include verification for anything like their bank statements, vehicles. If they had a new vehicle, for example, they'd have to include that with their renewal packet. And just a note about resources, most non-Magi households do have to verify resources at renewal. There are some exceptions to that. If a non-Magi household contains a child under the age of 21 or a spouse under the age of 21, resources would not need to be included at renewal for those types of households. And again, to reiterate that folks that are determined eligible using a MAGI determination, so again, that's pregnant women, children, and the adult expansion population, resources are not considered at all, so they don't need to disclose or provide verification of those at renewal. Once the renewal form is completed and all the verifications are gathered, the packet can be submitted in 4 different ways to the County Assistance Office for processing. The first is via mail. All packets include a prepaid envelope that the renewal can be dropped into and sent back to the CAO. If recipients need assistance in completing their renewal, we do have a consumer service center, and that number is there. When they call that number, they will have somebody walk them through the renewal form and submit that on their behalf. If the recipient themselves want to complete online, that's also an option. We have our online application form, which is Compass, and the website is there. They can log into there using the information from the renewal information letter, and they can go in there, complete the renewal, and submit it there. Also through Compass, if they have any verifications, they do have the opportunity in Compass. They can scan or upload their documents to go along with their renewal packet. And then, of course, as always, if they'd like to gather their documents and drop them off directly at their county assistance office, they can do that as well. And again, to reiterate, the renewal information letter contains instructions for those modalities, so they have that information available to them for completing their form and their packet. And just to also sort of put a reminder here that the due date on that renewal information letter is when their form and all verifications must be received by the county assistance office. And it's important for them to do that so that the county assistance office has it for processing on their behalf. Something that's important to the renewal process is that DHS has expanded ways that we can communicate with our recipients, and through the renewal process, they can get additional information and reminders about their renewal process, which can be pretty valuable. The first mode would be through text messages. It's something that recipients have to opt into, and the instructions are provided at the address listed here. But if they do sign up for text messages, they can get reminders about when their packet is coming, when it's due, just sort of additional sort of prompts to get them to complete that process. They can also sign up for emails from DHS. And again, the opt-in information is available at the website listed there. But it also provides another channel for DHS to communicate to the recipients about renewals and other information that DHS wants to convey. And then the last form of communication here is what we would be calling, they're called helper calls. But so if someone's not opted in for text messages or emails, they can get these calls that again are sort of to remind them and prompt them to complete the renewal process. It's just sort of an extra layer of, hey, make sure you get this done so your medical assistance can continue. And another way that folks can assist recipients with completing a renewal is to sign up to be a Compass community partner through our Compass website. We have what are called community partners, and these are agencies or entities that can sign up and basically, once you do that, then you have access to what's called the Community Partner Dashboard. And then you have the ability to complete and submit applications and renewals on behalf of recipients. So you can sit with a recipient, help them complete a renewal or an application, and submit it through Compass. The Community Partner Dashboard also allows community partners to receive updates and information about the applications and renewals that they submit, so they can answer some general questions for recipients about their benefits. It's just a really great tool that we have and a great way that folks can assist those in the community to complete their renewals and, like I said, applications as well. There's a lot of good stuff in the community partner dashboard that we have. So there's the link here is for how to register to become a community partner. The link is there. That page provides a step-by-step instruction of how to do that. It's a self-registration process. there's a self-registration guide that sort of walks through. It's all linked on the community partner page, and walks through that process. And like I said, just to sort of go over again some of those benefits of being a community partner. Like I said, you can submit applications on behalf, you can view the statuses of those applications, you can save applications. Like if you sit down with someone and can't finish it, you can save it and come back to it. You can help scan or upload documents that need to be submitted to the CAO. Community partners can help recipients locate their renewal date, so then they know when a renewal is going to be due. There are some capabilities for some basic reporting out of the community partner dashboard. And then it also provides some information and some links to DHS forms and policy, so the community partner has that on hand. Once the renewal is submitted and complete to the county assistance office, the county assistance office will process that renewal based on the information that's provided. If the household or recipient remains eligible for MA after that review, they are given a new 12-month eligibility period. So their renewal date in the system is pushed out for 12 months. If they're no longer eligible after that review, eligibility would be terminated within our system, and they would be issued a notice, and that notice would have that termination date for their medical assistance on it. It's typically 15 days after the CIO takes action that the termination date would be. But if the individual is enrolled in managed care, that would continue through the month in which the termination ends. An example here is that if their MA termination date was June 15th, managed care would continue through the end of June. For either outcome, though, at renewal, there will always be a notice issued to the recipient. Federal regulation requires us to send a notice, even if they're remaining eligible, just to let them know that they remain eligible and that they're eligible for another 12-month period. If someone were to be found ineligible for MA at renewal, one of the things that we do is to make a referral on their behalf to the appropriate insurance affordability program. And we have some information, sort of general information about the programs that we refer to. So for children under age 19 who do not have other health insurance, we would refer them to our Children's Health Insurance Program, or CHIP. And for individuals 19 to 64, they would be referred to our state-based exchange, which is Penny, which they are, as it says, our official health and dental insurance marketplace. So for both of these referrals, the household, if a referral is made on their behalf, they'll receive a letter from DHS letting them know that we have referred them. And then those entities would follow up with them if there was any additional information needed. For the renewal process, if the recipient or the household does not return their renewal or their verification by the due date, like as I said, MA would be terminated. However, individuals, they have 90 days from the date of termination to provide the necessary information to DHS, where we would still go in and review for ongoing MA eligibility. So say, for example, somebody is terminated from medical assistance in October because they didn't provide their packet. And then they realize that, and then in November, they gather everything up and send it to the county assistance office. That is still within their reconsideration period. So when the county assistance office gets that, they will review it and they will determine whether or not the individual is eligible for ongoing MA. If they are, the CIO will reopen their MA benefit, and they will open it back up to the date that it closed. So it prevents any gap in coverage for the individual. If after the review, they are ineligible, again, the CIO would then make that appropriate insurance program referral, so to either CHIP or Penny on the behalf of the recipient. Once that 90-day period has passed, though, a new application would be required to determine eligibility, and it's possible that they would have a gap in their MA coverage. So it's important to either complete the renewal process by the due date that's given in the packet, or at least within that 90-day reconsideration period, to prevent any gaps in coverage. And to sort of underscore the importance of the reconsideration period, we've developed a new letter that is going to be sent to households that have closed for MA because they did not complete the renewal process, but they are within their reconsideration period. And this letter is just letting them know that they have the option for reconsideration, and it again will provide instructions to them about how to complete and submit the renewal and any required documents to DHS and the CIO for review. Okay, so as we're wrapping up here, just some things about the renewal process that I think that I'd like everybody to take away today. First thing is to make sure that recipients have provided DHS with their most recent contact information, especially mailing address, phone number, email address. Having the most up-to-date information ensures that we're able to communicate effectively with recipients and that they get things like their renewal packets and these mailings and reminders that we generate on their behalf. The next is encourage recipients to sign up for our other modes of communication, like text messages and emails. Again, it's just another way to get reminders and information from us, and especially within the renewal process, reminders about when things need to be completed. Next thing is, again, I encourage if anybody is interested, if any agency or entity is interested in becoming a community partner, a Compass community partner, especially if you work with folks on a one-on-one basis, it's just a great way and a great feature to have to be able to submit information on people's behalf and sort of track that information. And also sort of another plug for Compass is that renewing on Compass for the recipient, it's a really quick and easy way to get the renewal completed. We're required by regulation to mail a packet when a packet needs to be mailed, but if a recipient doesn't want to go the paper route, it's just easier to go for Compass. Like it's easy to log in, fill it out, upload documentation, and just get it out of the way. But again, if a household does choose to go the paper route, we really just want to stress it's really important that it is signed, because that's something that we see often where the signature is missing from the form. And then the last sort of takeaway is that we really encourage that the renewal and the verification are provided by the due date. That's the best way to prevent any interruptions in coverage. Submitting during the reconsideration period, like I said, they'll reopen without a gap in coverage, but you have to wait for that processing time. So submitting by the due date is the best way to prevent interruptions in coverage for that. Okay, and for questions, I don't know, Lexi, if you wanted to.
Sure, I can jump in here, Kathleen. Uh, First, I want to thank everyone on behalf of PADHS and the Office of Income Maintenance for participating in today's webinar and for bearing with us during our technical difficulties with the platform. We truly appreciate your dedication to helping individuals stay covered in Pennsylvania. To be able to further assist in that process, materials from this session, I think I threw it in the other chat, but materials from this session are slide deck, webinar recording, or re-recording, question and answer for the questions that were submitted before or during the presentation, and I was able to capture both chat uh, boxes. We had some really great questions asked during this presentation, and certainly we'll follow up. And the timeline of what communications that MA recipients will see and when, all of that will be linked in a DHS PHE helper email coming soon to your inbox. Additionally, some of our previous content, or actually I think all of our previous content developed for the PHE helpers, as well as links to other PHE and renewal resources, can be found at our helper page, and I will throw that link in the chat. I also want to throw in right before this presentation kind of went live, so did that what people will see and when communications page. So I'm going to throw the link to that in the chat, because I think that's a great additional resource to supplement the material that we brought out today. Again, I want to thank you for your questions, and we will be happy to loop back around. And thanks for your participation. With that, I think we can go ahead and end this session. Have a great day, and we will talk to you again soon. Thanks for being a part of the PHE Helper Network.